So unfortunately, we know that Black folks in this country and Latinos too are getting coronavirus at much greater rates than white Americans, and they're dying at unfortunately even more disproportionately rates. We want to try to find out why, and so we brought on Kenya Evelyn. She's a breaking news reporter for Guardian US, and she's covered this. Kenya, welcome to the program.
Thank you for having me.
No problem. So first, let's go over the numbers. How bad is it? How disproportionate are Blacks and Latinos by coronavirus?
Essentially, the New York Times had to sue the Center for Disease Control and Prevention, essentially to even get these numbers released. But what the data is showing us is exactly what public health experts have been shouting from the rooftops since this pandemic began, that Black and brown Americans are disproportionately more likely to contract the coronavirus as well as die of COVID-19, the respiratory disease that results from the coronavirus. And so where we're seeing that is that Black Americans in particular make up a third of all COVID-19 cases and then a third of all deaths. And that is exacerbated among younger populations. We're talking about the second wave, although some states are even seeing their initial wave. Well, that is being largely led by the increase in numbers among young people. But even among young people, we're seeing people of color. Young people of color are disproportionately contracting and dying from COVID-19 compared to their white peers. And where we're seeing that is primarily with the relaxing of stay-at-home orders, those that are disproportionately putting these communities at risk, being that they are the majority of frontline workers and are more likely to live in multi-generational households.
Blacks are getting it at 3.6 times the rate of whites in America, and Latinos are getting it at 2.5 times the rate. And among 35 to 44-year-olds, Blacks and Latinos are dying at 10 times the rate. The mortality rate is stunning. So those are potentially two different phenomena. So let's talk about why they're getting it in the first place. So why do you think Blacks and Latinos are getting it disproportionately?
Well, the conversation is largely centered around race, and although that is correct, I would say more so racism. We have racial inequities, existing inequities in our healthcare system that exacerbate pre-existing conditions that Black and brown people are predisposed to, meaning diabetes, hypertension, issues like that make them more likely to have negative outcomes from COVID-19. But where we are seeing that they're more likely for exposure in the first place is that Black Americans and Latino Americans are more likely to live in an area where there is a void of a quality healthcare facility. They also are more likely to have their symptoms or even their pain disbelieved by medical professionals on account of racial bias. And then when you add on top of that, we have 75% of the meatpacking industry are people of color. We have 40% of all frontline workers, transportation workers. We have healthcare professionals. These are industries that are more likely to be have their frontline and essential workers be staffed by people of color. So when you already have vulnerable communities within your own household, because you're more likely to live in a densely populated city, you're more likely to have a grandparent as well as a parent or aunties or cousins or whoever in your household, that makes you not only more at risk on account of what you do and the life you live, but then that puts your family at risk by you potentially bringing back that virus while you're asymptomatic into your household.
Yeah, so unfortunately, is an excellent example of the vicious cycle of racism, because we talked about the meatpacking plants earlier today on the Young Turks, and they were forced to go back to work, and then coronavirus cases exploded because they weren't even provided masks, and they were right next to one another in an enclosed space for long periods of time. And that's a recipe for disaster. So now you have huge coronavirus cases in Iowa, Colorado, North Dakota, and South Dakota, and you could clearly trace it to the meatpacking plants. And so what? Well, right-wing racists, let's just be honest, say is, well, look at this. Blacks and Latinos are getting it more. It's because they're less careful. No, it's because they have to go work at a meatpacking plant. You just said 75% of the workers there are people of color, and then because of the historic racism, also in lower socioeconomic status, which means that more people have to live together, which then also spreads the virus, let alone the medical treatment that they're getting and the biases involved there. So when you look at it, it's right now, it seems like, unfortunately, it's the perfect storm hitting blacks and Latinos as we speak. I mean, you've got that plus the George Floyd situation, and I'm not sure that the rest of the media quite has grasped how devastating it is for minority communities in America. What's your sense of that?
Communities of color are going through 3 different pandemics simultaneously, and all of these are where they are disproportionately feeling the impact. We have a tanking economy, we have a established recession, we have a social uprising that is centering these very issues of race and social justice, and then we have a public health crisis. In fact, we have employees of the CDC begging and demanding that health professionals and the CDC declare racism as a public health crisis. Well, that's because, communities of color, they're 40% of their households are more likely to make $40,000 a year or less. And so when you're hearing that a majority of households that make $40,000 a year or less had someone within their home lose a job since March, since the beginning of this pandemic, well, you know that's disproportionately, that's impacting Black families, that's impacting Latino families, that's impacting Asian American families. We're seeing that happen in cities across this country. And so what is also happening is that there's a sense of racial bias impacting public behavior. When that virus or when this pandemic doesn't seem personal or in close proximity to you, it isn't personal to you. And therefore you tend to exhibit more reckless, more restless behavior. And that's why, like you mentioned, we see primarily right-wing extremists and white supremacists storming state capitals, demanding for the government to be reopened. Whereas when we see protests and demonstrations calling for racial justice, we're seeing protesters being blamed for the spread or any uptick in these cases, as opposed to those who stormed state capitals without masks. When much of the research is showing us it's parties, not protests, that are spreading, particularly among young people, that are spreading the virus.
Yeah, I forget which state it was, but they just explained, yeah, it was definitely the parties. And so I'm not saying that it didn't spread in any protests. Of course, there's no way of knowing that, right? And I get it, folks were close to one another. But the health professionals can sometimes trace back where the problem started in the first place. And I'm sorry, I forget which state it was, but they just announced earlier today, yes, it was the parties. And then I thought this story might have been apocryphal, but in Texas, a guy actually went to a COVID party, and apparently on his deathbed, his last words were, "I thought it was a hoax." So it's just, it's sad, it's tragic in a lot of ways. Kenya, it's so hard for anyone to have this answer, and I don't know that you or I have the answer, but I'm gonna ask it anyway. So what do we do in a situation like this where people gotta go back to work, the unemployment checks are about to run out, and there's, after July, desperation might start to kick in, and I don't know that they're going to get hired. It's, the Republicans keep pretending as if there's all these jobs and people don't want them, right? No, there are no jobs. They didn't leave voluntarily; they were fired. But at the same time, we're scared to death of coronavirus and its effects.
Well,
hence the question of what do we do?
You have to even look at this at the lens of, we are not in normal times. We are not under a normal administration. We are not under our normal sense. Our sense of normality is simply just completely gone out the window. And so you have to analyze, or you even have to look at what we're even seeing in our media discussions. There's a lot of introspection that is happening about where we go from here. What can we learn from the current society, our current socioeconomic output, our look at these glaring health disparities and this pandemic that is ravaging this country right now. In a normal situation, you would imagine in such a time of crises for America, multiple crises for America, we would do some introspection and say, what can we learn from this? How is it that this is exposing our very vulnerabilities as a country? The fact that healthcare is tied to our employment, or that there isn't a universal income to guarantee basic essentials and necessities as a human being in this country. We would expect that most adults and most people of sound mind and intelligence would use this as an opportunity to show where our weaknesses are as a country and to provide those stopgaps to essentially be a resource for the American people. But essentially, we don't live in that society right now.
All right, Kenya Evelyn writes for Guardian US. Kenya, thank you so much for joining us. Really appreciate it.
Yeah, and thank you for having me. On the go? Don't worry, we got you covered. You can still listen to TYT at our new podcast network. Find us on Apple Podcasts, the Google Play Store, or at tyt.com/podcast.